All right, Janice, thanks so much. We'll see you soon. This dangerous cold you're talking about, it's causing a Long Island COVID testing site to close just temporarily. Stony Brook University's south parking lot used for testing will close tomorrow and Saturday because of these dropping temps Janice is talking about. Now, hours will be extended on Sunday to accommodate rescheduled appointments. Well, we do have some more positive news in the race to vaccinate in the tri-state. Here in the city, the state has freed up almost 20,000 unused vaccine doses for immediate use. So far, almost 700,000 people have been vaccinated in the city. But the question is, do all of those people actually live in the city? That's the concern as more vaccine frees up those once shuttered vaccination sites. I want to head out to News 4's Andrew Siff, live in Washington Heights with Andrew, some of the policy changes after your reporting for us here.
Right, Natalie, this is a pretty busy vaccine hub. Even at this hour, people still arriving for their appointments, and existing appointments can still go to almost anyone in the tri-state area. But the hospital that runs this armory has tightened the rules, and going forward, the vaccines here are for city residents only.
I'm really surprised that they're sending me here.
Paula Cruz lives in Queens and never expected the vaccine hub she'd land an appointment would be Washington Heights. But that's nothing compared to the folks who traveled from upstate, not to mention in limos from the Upper East Side.
What happened in Washington Heights is the exact opposite of what we need.
Mayor de Blasio today said the city and state need to refocus on serving communities that need vaccines. And the hospital in charge of the Washington Heights Armory, New York Presbyterian, has now changed its policy. Effective immediately, 100% of new appointments at the center will be for New York City residents, and a minimum of 60% of all those appointment slots will be reserved for eligible residents of the Washington Heights, Inwood, Northern and Central Harlem, and South Bronx communities. Violet Cromwell, who lives on 155th Street, got her shot today.
So I just went in, I said, I don't have an appointment. So he said, just come across here, go in, and I got my vaccine.
It's hard for people here to get medical services. So the idea that you have to wait for other people when you're a block away would be sort of distressing.
Today at the White House, Press Secretary Jen Psaki said the crushing demand for vaccine should be easier in a few months.
We will be in a place by this summer where we will have enough supply for the public.
Today, the state did give the mayor 18,000 doses from the second shot stockpile, immediately available for first doses. And I asked the mayor about extra vaccine at sites like Worth Street. Amid concerns, some of it is going to waste. Even with the scarcity right now, aren't you also discarding doses every single day?
Obviously, our goal is to use every single dose, and there's been clear contingency plans put in place, I should say, to make sure that happens.
The mayor said he's still confident that by the end of February, the city will be able to administer up to 500,000 shots per week. And the reason he's so confident, the mayor believes that Johnson & Johnson, a third manufacturer, will have its vaccine approved in the coming days. We're live in Washington Heights. Andrew Siff, News 4 New York.
Andrew, thank you. New York's health commissioner is now pushing back on a report from Attorney General Letitia James that says that the state health department undercounted nursing home deaths by as much as 50%. Now, that report cites a lack of compliance with infection control protocols and insufficient PPE for staff back in March. Now, the governor had ordered recovering COVID patients to be sent to nursing homes to free up hospital beds. Now, that was a policy condemned for potentially increasing deaths in those homes. In August, Governor Cuomo talked about how the state classifies COVID deaths.
What some of them are saying is if somebody dies in a hospital who's in a nursing home, it should count as a nursing home death and a hospital death. Yeah, but then that double counts. We have an audit that says if you died in a hospital, you died in it's counted as a hospital death. If you die in a nursing home, it's counted as a nursing home death.
Now, in a statement, Health Commissioner Howard Zucker says the number of deaths in hospitals and nursing homes is full and accurate. And James' report is only referring to the count of people who were in nursing homes but then transferred to hospitals and later died. In Paterson, New Jersey, today was the last day this week that you could get a COVID vaccine on a first-come, first-served basis. People lined up for hours this week, we showed you, without an appointment at International High School. The vaccine site, though, is expected to open again next week. A Connecticut school district plans to bring students back to the classroom next week because of falling infection rates. But Ridgefield officials say that parents should not plan for the classroom learning to last too long because of this fast-moving UK variant of COVID. There are 58 known cases of the variant in the tri-state right now, 8 in Connecticut. News 4's Lynda Baquero has how parents are handling this news.
Right now, nothing is set in stone, but some schools are getting ready in case they need to pivot yet again and stop all in-person learning. Starting on Monday, public elementary schools in Ridgefield, including Veterans Park School, will go back to in-person learning full-time, but only for about 3 weeks.
We maintain social distancing and disinfecting and wearing masks that, you know, it's very safe to stay in school.
If everybody is just adhering to everything that they say they're doing properly, that's great. But it's ultimately up to the mom and dad and how they feel.
Come March, things may change. In a regular weekly call with school administrators, the State Department of Public Health warned that the CDC says the new coronavirus strain from the UK, said to be 30 to 70% more contagious, will be prevalent here in March. After the meeting, the Ridgefield School Superintendent sent a letter to parents letting them know that the district is buying 3,000 face shields for students in grades K through 8 to use during lunch when kids take off their masks. And she warned schools may have to switch to full remote learning in March. Governor Lamont is hoping to avoid that.
I'm fairly confident that if we continue our flow of vaccines, they continue to up the ante, we're going to be having school in March.
In the meantime, families are urged to continue social distancing, wearing a mask, and washing hands frequently to try and minimize the chances of schools being forced to close again.
I've watched some of my younger friends with their little ones. Yeah, it's, you know, there's no day that's too, or no point in the day that's too early for wine.
This is just a plan, again, in case we see an uptick in cases involving those new coronavirus strains. But again, the governor hopes that that will not be necessary. In Ridgefield, Lynda Baquero, News 4 New York.